your analysis then of what's making the front of most of the papers this morning, and building on what Theo was just saying there about the state of affairs, particularly in critical medicine, acute medicine in A&E.
I think it's just worth reflecting. So often the conversation about the NHS revolves around the system, around staffing, but I think it's worth just thinking about patient experience, which I just feel we don't talk enough about how terrible an experience it is for patients in normal times in the NHS. And at a time like this, when it's in crisis, people are dying because of poor care. And I just think it's worth putting that patients back into the conversation here. And thinking about the structural changes that are needed to make the system work better for vulnerable people who are sick.
Yeah, but it's a variety of problems the NHS is dealing with right now, isn't it? It's A&E gridlock, problems with urgent care, emergency care, and more strikes to come. I mean, what do you think could be a possible solution for this? It doesn't appear to be short term.
Yeah, as you say, this is the result of decades of failure to properly structurally reform the NHS, made more acute by the situation, the backlog of COVID, and of course the nurses' strikes. I don't think you can blame any one of these factors. I suppose the immediate challenge is to resolve this trade dispute with the nurses. It's clear that the nurse and ambulance driver strikes is exacerbating an already terrible situation.
How do you resolve that then, if they're asking high figures above inflation, around 19%? We understand that just a 1% increase equals £900 million in addition to what they're already getting in the NHS. How do we resolve that? We haven't got a bottomless pit.
Yeah, absolutely. Yes, absolutely. I think the government needs to be much more honest about the trade-offs. As you say, 1% pay rise for nurses could actually employ 13,000 extra nurses, which could really help the situation. So I think we need a much more honest conversation about the trade-offs. And I do think that there are things that the government could do to ease this strike. So, for example, nurses get a lot of their benefits in the forms of pensions. Now, there could be an option perhaps to front load some of that, and people could take their pensions early in a bigger wage packet while they're struggling. That could be one real solution. But I'm not saying it's easy, and I'm not saying it's going to be easy to win the public around to having this much more honest conversation about the NHS, taking the kind of quasi-religious worship of this broken system out of the conversation and talking about why it's failing patients and how it really desperately needs deep, deep structural reform.
We're asking our viewers this morning, Alys, for comments. We've had a few. I just want to bring in one from Nick from Bristol, who says that the NHS doesn't have a funding issue. They've never had as much as they are given now. They have a spending issue. And he also points out it's top-heavy, the NHS, with managers paid up to £250,000 a year without medical experience and put into jobs that would be much better managed by matrons or sisters of the wards. Does he have a point?
Yeah, sounds like we should put him in charge. I think, yeah, it's absolutely true. We spend a sort of a reasonable average amount for an OECD country on healthcare, and we seem to get terribly poor results. I'm not sure why that is, but it does seem like the NHS is just a bottomless spending pit.
Just picking up on the point about... Go on.
Sorry, I think that perhaps has something to do with why Britain has this kind of, like I say, this almost religious worship of the institution. I don't think that other countries have that. And I think it prevents us from having a much more honest discussion about what it should do, what it shouldn't do, and what patients should be able to expect. Because this idea that we shouldn't be bothering our doctors when we're sick is just absurd.
Yeah, and politicians have to take some responsibility for that, because many of them just too timid to risk what they see as electoral defeat by tackling this quasi-religious organisation, as you describe it. But I just want to pick up on the 13,000 extra nurses that a 1% pay rise could pay for. The reality is that might be right in terms of numbers, but you're not going to be able to attract 13,000 new nurses to the profession if you continue to work them at the rate where they're facing a real terms cut in their wages, but they're also burnt out. Nobody wants to do it anymore.
Yeah, absolutely. You're seeing lots of nurses go into the private sector where they're not actually getting better money, they're just getting better working conditions. Now, obviously, part of that is because they are so short-staffed, so it's a kind of a circular problem. But yeah, we absolutely need to to think about the NHS from root to branch. Why is morale so poor in a job that should be so rewarding when you're one of the most respected professions in the whole country, when people go out on their doorsteps and clap you, and yet your morale is at rock bottom? There's something deeply, deeply wrong here. And it's a problem decades in the making, and it's being exacerbated by the current crisis.